Ultherapy versus Pelleve. I have heard horror stories of Ultherapy melting fat off the face, which is not my goal at all. In fact, my face is too thin. I am looking to tighten up skin on arms and legs, which look very crepey, and some cellulite on thighs. For face, looking for overall lifting.
Thank you for your question. You're asking Ultherapy versus Pelleve. And in your question you state you've heard horror stories of Ultherapy melting fat out of people's faces. And you described your main concerns of tightening skin in the arms and to deal with some cellulite, and you want a lifting of the face, and you stated also that your skin is already very, very thin. Well, I can certainly give you some guidance. I'm a board-certified cosmetic surgeon practicing in Manhattan, Long Island for over 20 years. I have witnessed a lot of technology come and go over this 20 years, and I can certainly give you some guidance as to getting realistic results. So to begin with answering the question, I would simply say neither is a good choice for you given this case scenario. You see, the reality of collagen stimulation through heat induction is that there is a limit, and part of that limit is the actual skin itself. There is an overwhelming demand for solutions for improving skin quality, for lifting, for all types of things that help fight a lot of the changes of aging. I actually wrote a book about this a few years ago, and facial cosmetic surgery has been constantly, there's been this battle between non-surgeons and surgeons about best solutions for facial aging. The reality is there is some key elements that have to be understood before you offer solutions. So for thinner skin, we have to realize that you can only heat it so much before that skin breaks down. So the quote horror story of Ultherapy causing fat to reduce in the face is not an uncommon story, but not just with Ultherapy, but with any radiofrequency or laser device where there's a lot of heat being generated, because the skin can tighten up to a point, and when you have the intention of, quote, lifting the face, well, you have to get a proper assessment. Let's just focus in on the face part of this question. In lifting a face, we look at people and we decide what are the issues. Facial aging is manifested by volume loss, such as bone, muscle, fat, soft tissue, as well as sagging or descent. Descent of the skin, descent of the support of the skin, called the SMAS, or the superficial musculoaponeurotic system. Now, as a cosmetic surgeon and a specialist, I do everything from non-invasive, such as Pelleve. We have Pelleve in both our offices, to injectables, to surgery. In fact, if you do have a relatively thin face, you may not be a great candidate for surgical facelifting. You may be a candidate for something that we do called a Y-lift. And this is based on a concept of structural volumizing. When you're talking about skin that's thin, well, it might be better to add volume at the bone level, so that, and that's an injectable, and it's a technique where we're able to accentuate or restore volume in the structure of the face, and it creates a face lifting effect. And so you don't have to necessarily just feel limited to these thermal devices. When it comes to the technology in the field of cosmetic medicine, dermatology, etc., there is so much messaging and there's so much hype that there is no question that a lot of people, including doctors, get easily seduced by the claims. And then there's always a few hired gun doctors who will make these statements about any device as long as you pay them. So people will often go from one device to another device to another device looking for the Holy Grail. And doctors will do the same. Doctors will tell a patient, let's do this particular thermal device. If that didn't work, let's go to this thermal device. We actually in our practice help rehabilitate the skin by using something called platelet-rich plasma to try to stimulate back some collagen and some soft tissue quality because of the, quote, damage that is done by the aggressive use of thermal devices. As far as cellulite is concerned, or crepey skin quality in the arm, I would say there's no good solution for cellulite, regardless of what manufacturers of thermal devices or various technologies will claim. Patients want to see dramatic improvement. They don't want to see 5% improvement. And when it comes to the crepiness of the skin in the extremities, again, there are limitations, and I would advise against any of the devices that are being overhyped. You notice there's a cycle. There's a device that comes to the market, they reach all the talk shows, and then everybody starts consuming, and then before you know it, that device becomes obsolete, and people say, oh, well, that was old, let's go to this next device. Clearly, there's no good solution. Otherwise, everybody would be doing something more consistent. So I would say, again, I would advise against both. I would say do a consultation with doctors about your options. You'll find you'll get a lot of different opinions. Use the smell test, use your gut instinct, but understand that thermal energy devices have a role, but they are overused and unfortunately over-abused, resulting in not the best outcomes for patients. So I hope that was helpful. I wish you the best of luck. Thank you for your question.